So now we are going to discuss regarding the vitamin A and micronutrients deficiency. So this is the pediatric topic, so we cover in this vitamins and micronutrients. So our content is vitamin deficiency. So fat soluble vitamins are A, D, E, K, and water soluble vitamins B and C we covered in this series. So and also we covered the minerals like zinc, iron, copper, iodine, magnesium, and selenium and chromium. So now we are going to continue with the vitamins. So vitamins are water soluble and fat soluble. So water soluble vitamins are non-B complex like ascorbic acid, vitamin C, and B complex, vitamin B complex are the energy releasing homeopoietics and others. So in the which the vitamins release the energy are energy releasing are vitamin B1, riboflavin, vitamin B2, and niacin, vitamin B3, and biotin, and also pantothenic acid, and which are helpful for the homeopoietic like formation of the blood. So these are the folic acid and vitamin B12, and folic acid is vitamin B9. So now in the other there is pyridoxine and vitamin B6 and pyridoxal and pyridoxamine. So all these vitamins we discuss in further coming lectures. And then there is the fat soluble vitamins. Fat soluble vitamins are vitamin A, retinol, beta carotene, and vitamin D are cholecalciferol, vitamin K, phyloquinones, and the menaquinones, and vitamin E is tocopherol. So these are the fat soluble vitamins. And now I am going to continue vitamin A deficiency. So vitamin A deficiency characteristics and the specific sign of the vitamin A deficiency on the eye lesion. So these are the classification: X0, X1A, X1B, X2, X3A, 3B, and XS and XF. So these are the classifications. So initially there is a list of these night blindness, then conjunctival xerosis, then lead to the Bitot Spots, and then corneal xerosis, and then there is the corneal ulceration and Keratomalacia. So less than 1/3 of the corneal surface. If there is a more than one surface, then it is in the group X3B. So corneal ulceration and Keratomalacia. And then XS there is the corneal scar formation, and then there is the fundus. So Xerophthalmic fundus. So these are the characteristic and specific sign of the vitamin A deficiency on the eyes. So in the ocular lesion we can see conjunctival xerosis, there is a dryness of the eye, and then after that there is a Bitot Spots, and then Bitot Spots, and there is a scar in the corneal scar, and this is the xerosis. This is corneal xerosis, and then we look for the corneal ulceration and Keratomalacia. This is a corneal ulceration and Keratomalacia, and there is a fundal changes seen in the fundoscopy. So there is a systemic sign of the vitamin A deficiency. These are the increased susceptibility of the infection, like for example pneumonia in the child, then skin pyrenoderma and follicular hyperkeratosis, and then there is the squamous metaplasia of the renal pelvis, uterus, and vaginal epithelium, pancreatic, and the salivary ducts. Also there is impaired immune function, and after that there is a prolonged diarrhea, and there is as a systemic manifestation is growth retardation. So this is the systemic manifestation of vitamin A deficiency. So how can we treat? So we can treat giving the 30 mg of the vitamin A, or the 1 lakh international unit of vitamin A. So age and doses are classified as. So age, if the infant is less than 6 months, so we can give 50,000 of international unit of vitamin A. If the infant is more than 12 months, or then we can give the 1 lakh of the international unit, and the children is the more than 12 months, and we can give 2 lakh of the international unit of the vitamin A. So if there is in this age group, if there is a xerophthalmia, so first day, second day, and after the 4th week we can give the vitamin A with this dosage. And if there is a severe complication, so we can give first day, second day, and after the 2 week of the ocular manifestation. And if the age group of this and the condition are the complication, and the complication and the symptoms are diarrhea, severe malnutrition and respiratory disease, then we can give the single dose of this 100 1 lakh international unit of the vitamin A. So in the prevention, so biannual vitamin A supplementation for the children between the 6 to 59 months of the age, first week of the Baisakh and Kartik in given in the Nepal, and then there is a 6 to 11 month of the age or less than 8 kg of the baby, then we can single dose of this 1 lakh international unit of vitamin A. And then if there is a 12 to 59 months of the age of group of the baby and more than 8 kgs, then we can give the 2 lakh of international unit vitamin A. And if there is a postpartum vitamin A, then we can give up within the 14 days vitamin A. So this is regarding the vitamin A.